attempts to curtail many of the problems associated with the current healthcare system, President Barack Obama signed the Affordable Care Act into law. The White House claims that the law puts in comprehensive reforms that improve access to affordable health coverage for everyone and protects consumers from abusive insurance company practices. The Affordable Care Act, often called Obamacare, is a very complex law that is going to drastically change the current healthcare system in America. The main idea behind this program is to grant every American access to some kind of health insurance plan, and in the end offset the costs associated with caring for the country as a whole. These new regulations will be set for private insurers, public insurers, employers, and the general public. And to ensure that the system is successful, everyone must participate in buying health insurance. After reviewing some of the aspects of the law, it is apparent that the system relies heavily on private insurance companies. Starting in 2014, individuals lacking coverage will be forced to pay an annual tax penalty. Those not in compliance with the law will be required to pay $95 starting in 2014 and gradually rise to $325 in 2015 and $695 in 2016. For 2016, the penalty will rise annually depending on the cost of living adjustment. Under the Affordable Care Act, insurers will have numerous guidelines to follow that intend to protect the consumer and provide more services. Insurance companies will now have to abide by the 80-20 rule. This rule requires insurance companies to spend at least 80% of a membership on health and medical costs. Another provision that insurers must follow is to provide access to preventative services, like cancer and diabetes screenings. Also, all health plans must provide customers with a package bundle or services of essential health benefits. These benefits must fall within 10 categories, including emergency service, maternity and newborn care, prescription drugs, and even mental health and substance use disorder services. This means that an individual that may not need some of the benefits will be forced to pay for them. Along with these new rules and standards for private insurers, they will also be required to pay fees to help pay for the system. It is estimated that this fee will collect as much as $8 billion and increase to $14 billion in 2018. The Committee on Taxation estimates that the health insurance tax will exceed $100 billion in the next 10 years. Although there are some taxes that do not directly affect insurance providers, these fees will have a great impact on premium prices. A recent study of California insurance providers shows that they may be increasing premiums for some customers at 20% or higher. They then go on to state 26% by Blue Cross, 22% by Anthem, and 20% by Blue Shield. When President Obama first introduced healthcare reform, he assured the public that his healthcare plan would not interfere with people that were satisfied with their current insurance. He stated, "If you like your healthcare plan, you'll be able to keep your healthcare plan, period." As the law began to take full effect, insurance companies began sending letters to customers stating that they would soon be dropped from their plans because their plans did not meet the minimum standards set by the ACA. It even showed that nearly 2 million Americans were told they couldn't renew their insurance policy. Under this healthcare reform, every individual will not lose their health coverage, and in some situations they will be provided with better, perhaps even cheaper coverage than they once had. For in some situations, individuals will be provided with more expensive plans that may not cover the same level of coverage they had on the previous plan. The problem only becomes an issue when people who are currently insured have policies that fail to comply with the many provisions under the law, such as the 10 essential health benefits. When this occurs, their health provider is forced to contact them and tell them that their existing plan is insufficient and they will need to find a new plan. In regards to overall healthcare reform, it is important that people realize that these extra benefits and services come with a price. As with every reform, there is no immediate solution to the problem, and the only way to find this solution is through bipartisan agreements and majority support.
Created using Powtoon.